Hi, I'm Dr. William Starsiak at Starsiak Osteopathy Clinic in Indianapolis. And I've made a lot of videos over the last few months, but I've been a little remiss in making any on osteopathy. So that's what I'm going to do in this video. Osteopathy is the cornerstone of everything that I do and is the reason I'm a doctor. Unfortunately, the majority of people don't even know what osteopathy is. And the people who are familiar with it have difficulty describing it. So in this video, I'm going to answer some of the big questions about what osteopathy is. So first off, an osteopath, or a DO, a doctor of osteopathy, is a fully licensed physician in every state in America. We can prescribe medication, perform surgery, diagnose, treat, cure illnesses, just the same as an MD can. And we learn all of the same things as them. We perform identically on standardized testing. We're not better than them, they're not better than us when it comes to the basic scientific knowledge in medicine. However, we also learn how to treat the body manually with our hands. To address, we could simplify it by saying to address the body structure. At this point, a lot of people say like, oh, so like, how's it like chiropractics? Because everybody's familiar with chiropractics, and I'll quickly address that. So osteopathy was discovered by an MD back in the 1800s, Andrew Taylor Still. And he brought his discovery of this connection between structure and function in the body and how he could treat structural irregularities, dysfunctions, and resolve all manner of conditions because structure and function are interrelated. And that came to be one of the osteopathic principles. In 1874, he opened his first school because the MD establishment wouldn't listen to what he discovered. And he brought it to the people who should have been most favorable to him. He brought it to basically his family. He helped physically build a medical school with his family. His father was a physician too. And they laughed him out. They wouldn't listen to him for some reason about what to me seems very common sense. Structure and function are interrelated. You change the structure, you change the function. You know, if somebody has a bad injury to their knee, pretty much any doctor that knows anything knows that they have an increased risk of developing significant arthritis and having arthritic pain. So something happens in that injury that changes the structure. And then that change, when played out over time, develops into osteoarthritis. So basically what happens is the ligaments become imbalanced, the fascia becomes imbalanced. Muscles try to react to fix that. Nerves can be altered, where their flow is not as normal and fluid. And so then that can have downstream changes in how contracted or relaxed vasculature is, the amount of tension being held in muscles. And then you play that out over time, this excess friction because the balance isn't right, and arthritis develops. For some reason, in the MD world, it stops there. You know, manage the symptoms, take NSAIDs, take ibuprofen relief, or go see physical therapy, where there's some great physical therapists out there. And a lot of osteopathy is actually leaked out into other disciplines like physical therapy. Some of the best physical therapists are using osteopathic principles. And even just exercises can be very beneficial. But true osteopathy brings in something additional, actually addressing the change that occurred during the trauma using the body's own healing forces, these inherent motions that help the body heal. That's another one of the principles of osteopathy, is that the body is self-healing.